Welcome to the Abbott SoToxa Mobile Test System Training video. This video will cover the basic usage and care of the SoToxa system. This unique portable system offers a combination of rapid oral fluid drug screening with accurate test result interpretations. And with its handheld portable design and immediate test results, it provides detection of drug use much closer to the time of an incident or violation. It identifies the presence of illicit or prescribed drugs that may be in the subject at the time of collection. The SoToxa analyzer can detect the presence of the following drug classes at the specified levels. When you receive your SoToxa system, you should have the following components. 1. The SoToxa mobile analyzer. 2. A micro USB cable for connection to a PC. 3. A printer and cable for connection to analyzer. 4. A wall power supply and cable used for fixed operation or recharging the test unit and printer batteries. The printer will only charge via the included RJ12 printer cable when connected to the analyzer, and the analyzer is connected to a power outlet. If the printer is offline and charging, the printer's green status light will flash every 1 to 2 seconds. Then the light will go off when charging is finished. If the printer is online and charging, then the printer's status light will remain on as a steady light. The SoToxa package should also include a carry case, which will hold all of the system components and allows for testing while the device remains encased and protected. 2 quality control test cartridges labeled PQC and NQC. To perform the QC function, simply insert each PQC and NQC in turn at the beginning of each session and follow the screen prompts. If the analyzer displays a fail screen during a QC check, refrain from testing until speaking with Abbott customer service. In addition to the system components, you will need the SoToxa test kits. Each individual test kit includes the test cartridge and collection device. Each component is within an individual foil pouch, which is sealed and provided in boxes of 25 test kits. Lot number and expiration date can be found on the box and on each foil pouch. Note: the SoToxa analyzer will not allow the use of an expired test cartridge. The SoToxa test cartridges and oral fluid collection device are designed for single use only and must be disposed of after use. Never reinsert a used test cartridge into the analyzer or reuse the collection device. The SoToxa analyzer can be powered from a power outlet or by its internal batteries. To connect the analyzer to the power outlet, Step 1. Insert the AC power cable into the PSU. Step 2. Connect the PSU to the power cable connector, located at the top of the analyzer. Step 3. Connect to the corresponding AC power socket. Step 4. Turn on the analyzer by pressing the power button. If a power outlet is connected when the analyzer is running from batteries, the analyzer will switch to the outlet as a power source. When the analyzer is connected to a power outlet, the main connected symbol will be displayed in the status line. The analyzer will automatically operate from a battery when turned on, if not connected to a power outlet. In addition, if outlet power is lost or interrupted, the analyzer will switch to battery power automatically. To manually switch to battery power when in use, simply disconnect the analyzer from the power outlet. Performing a test. Step 1. Power on the analyzer. Instrument will go through a self-test and when completed, prompt the test administrator to insert the test cartridge. Step 2. Remove a test cartridge from its sealed pouch. Be sure to inspect the packaging for damage or tears. Always discard test cartridges that have damage or have breached packaging. Each foil-wrapped test cartridge is packed with a silica gel packet. The silica beads are designed to change in color when moist and act as an indication that the kits have been stored correctly and have not been exposed to water vapor in the air. The silica packs are made from an environmentally friendly synthetic silica indicating gel that is impregnated with a color-changing agent. The silica gel packs are yellow when dry, indicating that the kit has been stored correctly and has not been exposed to the external environment. When moisture has been absorbed, the silica packs will turn to green, as seen here, indicating that water vapor has entered the packaging. If the silica gel pack is green, discard the test cartridge and contact customer service, as the performance of the product may have been compromised. If the silica gel pack has burst, discard the test cartridge and contact customer service. Once inserted, the analyzer will read the QR code to identify the cartridge and verify the lot number, test panel, and that it is within its expiration date. Following the test cartridge identification and verification of the expiration date, a green check will appear on the screen. Then a test process screen will display, giving instructions for proceeding with the sample collection. If needed, additional guidance on each step of the test process can be obtained by selecting the Help function on the analyzer screen. Obtaining the saliva sample. Following oral fluid collection best practices, we recommend no eating, drinking, or smoking 10 minutes prior to sample collection, such as gum, drink, food, or tobacco products. If you're not sure, wait 10 minutes and then do the test. As with the test cartridge, be sure to inspect the packaging for damage or tears. Always discard the collection device if the packaging has been damaged. Ask the donor to remove the collection device from the foil pouch, ensuring they hold the plastic stem of the collection device, and then place it in the mouth, as seen here. The donor must actively swab the collection device inside the mouth, around the gums, tongue, and inside the cheek until the sample presence indicator starts to turn blue. An adequate sample has been collected when the indicator starts turning blue. Insert the collection device into the test cartridge, which should already be inserted into the analyzer. Push the collection device all the way into the test cartridge to the stop position. While inserting, you will feel slight resistance just before the collection device is completely inserted. Press firmly to puncture the seal and insert the collection device until the plastic retainer is flush against the test cartridge, as seen here. Once the sample collection device has been inserted, the analyzer must be kept in a horizontal plane while remaining as still as possible throughout testing. If the analyzer is tilted beyond the acceptable range, this warning symbol will appear on the screen, along with an audible warning. Once the analyzer is returned to the correct horizontal position, testing will continue. Once the sample has been properly inserted into the test cartridge, the screen will display Test in Progress, and a countdown timer will appear indicating the remaining test time. If needed, the system will allow up to an additional 60 seconds of runtime. Once the analyzer timer has completed, the instrument beeps and the SoToxa has finished processing the test. Results will be displayed on the LCD screen as positive or negative against each corresponding drug category. Invalid may be seen against a drug test result, depending on your region. Please refer to the user guide for further information where applicable. Please note, if test results indicate that a drug is positive, we recommend that a second sample be obtained from the donor and sent to a laboratory for confirmation testing and quantitative results. Printing results. If you would like to print results, make sure the printer is connected to the analyzer and turned on, and when prompted after testing, select Yes. If the printer is not powered on or connected once a test is completed, a printer failure screen will appear if you choose to print. A new screen will appear allowing the test administrator to power on or reconnect the printer to the analyzer. The test administrator would then click Retry to print the result. If no additional copies of the results need to be printed, simply click No to proceed. Completing a test. Once a test has been completed and the results have been printed, Remove the test cartridge by gripping the cartridge and gently pulling outward. Do not pull on the collection device. Instead, gently remove both the collection device and cartridge at the same time as seen here. Dispose of it according to local regulations. This concludes the collection and testing process for the SoToxa analyzer. Additional resources for the setup and operation of the device can be found in the user guides and instructions for use that are provided with the product.